Okay, Gladys, so what I'm going to do now is some cupping, which is going to help relieve your pain. It's going to bring in more blood flow to the area, and you're just going to feel a little suction in the area. And I'm going to start on your lower back. I'm going to use 2 sets here. And this is just to increase the blood flow to the area. This is also really good for respiratory conditions. So I'm going to go up your back. And then if you remember, Michael Phelps had this done. He was sporting his cupping marks in the Olympics. And these are all different sizes. And then we're going to do 2 here. Okay, so what I'm going to do is I'm going to leave those for just a couple of minutes. You're not going to get the red marks because it's not going to be long enough. It's usually 10 minutes. But I'm only going to leave it for 2 minutes so that you can get that sensation, that blood flow to the area, and I'll be back. Okay, Gladys, how are you feeling? No pain? No. Okay, so this is what we're going to do now. I'm going to start gliding the cups over your back. It's going to feel really great. It's going to feel like a deep tissue massage. It's just going to bring the skin up, and we're going to move it along. So this is what we're going to do. I'm going to start on the top, and you're just going to feel that nice sensation. Does that hurt? I'm going to do the other side. So you're not going to have any marks whatsoever. And then we're going to do the other ones, and we can actually use 2 at a time. I'm going to go all the way up and down the urinary bladder meridian, just along either side of the spine. I'm going to use these. And do 1 at a time. And then these. And these are covering the bigger areas, so we can slide these along. This is a different technique, but it feels very good, and it's very effective for pain and increasing blood flow to the area. So we can go all along the hip area, the sacroiliac joint, which is where we have always a lot of pain. It's very sensitive on most of us, actually. So we're going to go out. How's that feeling?
That's good.
And now we can do both cups at the same time, like we're playing air hockey. And now we can start moving these back. And we can use these up in the traps and in the neck. So we're combining the 2 techniques. We're leaving the cup stationary, and then we're gliding along the back, all those areas that are affected. So we're going to remove these. And I'm just going to leave 2 on you. And these are going to go all the way down and up either side of your spine. This is going to be very relaxing. It's going to help release all that connective tissue over the muscles, creating restrictions in our movement, in our range of motion. We always want increased blood supply because blood carries oxygen, and oxygen promotes healing. So that's always our goal. We want the area to heal as fast as possible in the most natural way. Okay. All right. Excellent. How did that feel?
That's great.
Okay. All right, so that is the cupping.